Tyrell Friday here with FutureDDS.
Tyler Brown here with FutureDDS.
And today we're here with Dr. Litwin. We're just having a conversation, kind of picking his mind about, projections and kind of the journey after dental school. Dr. Litwin has done, graduated from dental school, has done the GPR, has done specialty residency, has been practicing for a few years now. So, we're definitely trying to pick his brain and just get a good perspective as upcoming graduates or fresh graduates heading into the field. So, thanks for sitting down with us, Doc.
Yeah, no problem. My pleasure.
And so, Doc, if you can you kind of just like walk the audience along your journey? So like, what have you done? I know Tyrell just mentioned that you did a GPR, you specialized, but can you kind of walk us through your entire dental school journey?
Sure. So I'm from New York, graduated college, SUNY Albany. I ran into a state University of Buffalo for dental school. That was an interesting journey. It's just, dental school is, it's great experience with friends and also kind of very stressful dental school. I finished off that, went right into a GPR. That GPR was Newark, Beth Medical Center in Jersey. That program for me was the best. I was lucky to get into it. There was around 70 attendings. And for me, that's kind of what makes or breaks a program is how many brains can you pick. After that, I went right into perio at the University of Kentucky. From options for me, I always kind of try to find state schools. I always like state schools. When I got to Kentucky, first thing I did was apply for a job, as a general dentist to kind of pay for the whole thing and kind of have a living, because perio, you have to pay for the program. So I got a job as a general dentist, working from around 5 o'clock at night to around 8 o'clock at night, about 5 days a week. And so I do perio, run into the office, do general dentistry, and then slowly incorporate that perio experience into my general dentistry practice. Meanwhile, while in perio, I would fly into New York, work at a perio office. So I'd fly in on a Friday night, work Saturday, go to the beach Sunday, and fly back to Kentucky. Did that for about a year and a half, 2 years. After that, I graduated Kentucky, went to New York, started working, and then came up to Boston. And now here I am. I work 5 days a week full-time here. And I still go down about every two weeks to a colleague's office in the city and New York just to do some implants, extractions, and bone grafting and things like that.
Awesome. So that's a lot. So we're gonna break it up, right? So let's start at you're about to graduate from dental school.
Sure.
Tyrell and I, we're in the situation right now. Why did you decide on doing a GPR versus an AEGD?
So for me, I like to have the I got colleagues that AEGD, GPR. To me, they're always kind of about similar. My thought was, like I said, I wanted a program where I could have as many attendings as I could. Right? I want as much experience. I want guys to tell me, hey, I've been doing this for 40 years. This doesn't work. They taught you this, but this doesn't last you. So for me, it was get something in the hospital based for me, which was good because you could try more. You have you kind of dip into the medical field a little bit more. And so for me in selecting GPR, it was who has the most attendings, right? Is it a program with, residents that were from one school or from a lot of different schools? So when I sat down at my GPR table with about 12 people, everyone was from a different school, right? So you lose that, you gain a variety of insight when your colleagues from Tufts and you're from Buffalo, or he's from Rutgers and he's from UConn. So to me, that really made a good GPR for me.
Yeah. Got you. So I guess if you could just walk us through a little bit of how that GPR experience was, how you felt going into it. I guess confidence-wise, was it more so confidence? Was it, where you wanted to work that steered your decision into even doing an AEGD or a GPR? And then how was your experience, throughout, and, building that?
So I think like a postdoc program in terms of GPR, AEGD, you can have a good experience with either one. For me, my key indicator is attendings, right? In terms of my experience, you graduate dental school, I think you did 10 crowns, right? To go out and then do a full arch or something like that. I wouldn't feel confident doing it, but to have someone kind of guide you, to know that if you mess up a little bit, you can disappear, right? You don't have to, you're not going to get a phone call. But for me, it was a great experience in terms of meeting colleagues, right, that were outside your dental school realm, that I still hold those relationships. I think graduating and after really having that clinical experience, it did a lot for me in terms of general dentistry. And it pointed me in the direction of saying, all right, Steve, you want to be a periodontist? Do some perio, do some real perio, the stuff they wouldn't let you do, in school. You want to do a sinus lift, do a sinus lift. You want to do some veneers, you want to do some third molar endo, whatever you want to do, try it out. So if you commit yourself to perio, commit yourself to oral surgery, whatever it is, you really got into the meat of it,
And so I think I already know the answer to this question, but you know of our situation as far as us not being able to be in clinic as much due to the COVID situation. So I'm assuming that you would recommend for students graduating dental school, especially in this pandemic, to pursue one of these residency programs?
No, I think in my experience, from what I've seen in terms of doing it and then watching other people do it, I think if you have the confidence to go out and do it from scratch, then man, do it. I mean, I'll tell you, I learned more in private practice than I did in GPR, right? But I also learned more in GPR than I did in dental school, right? I mean, so it's when you do something without a net, you really do it a lot harder and you do it a lot better. If you have the net, sometimes you don't care as much. So I think if you feel confident after dental school to go right into practice, then go right into practice. I have a lot of friends that do it, a lot of colleagues that did it. And Anthony, we were talking about it earlier, is if you're in dental school and you have an excellent experience in dental school and you're living and breathing spear or whatever it is you subscribe to, then go for it. I mean, like I'll tell you, I'll learn more in a month in private practice than I did in a year in GPR. But who's to say that I would have had that month if I didn't do my GPR?
Right. Okay.
So I guess just now that this residency thing is kind of on our mind, my biggest thing is like, what are some of the pitfalls, or what are some of the things that, looking back on your GPR application cycle and going through that process, what are some of the things or tips that red flags that you would I guess advise us look out for, or kind of put a magnifying glass on while we're going through it?
So I think the most important thing, no matter where you're applying to, is you got to visit the program beforehand. That's even if it's across the country. If you want to get in there, showing up, showing your face there, it'll put a name to your face, right? It's like, oh, I saw Dr. Brown here. He came to visit. Let's get him in here for an interview. And once you get that interview, your resume is out the window. The minute you have an interview, they do not care about your resume one bit. And so for me, when I was a GPR resident, we would interview the new residents. When I was a perio resident for 3 years, we would interview the new residents. And the only reason, the minute they're there, they're 100% qualified to be there. Do they fit in? Are they a nice guy? Can I deal with them or gal? Can I deal with them for a year? Can I deal with them for 3 years? Right. My GPR director would always says the current residents are the a-hole detectors for the new residents. Right. They want to make sure these people are just, they could play well with others. That's it. And they want someone teachable. If you go in there trying to show up, hey, this is how much I know, they don't care how much you know. We don't want you to know anything. We want you to be open-minded to learning new things. And so I think if you could present that, that's gold.
Awesome. And so you did your GPR, but then you went back and specialized. Like, what was your thought process with regards to that? I know you said that you had gotten some perio experience, and was it that you just really enjoyed perio, so you decided this is what I want to do, let me go specialize, or like, what was your whole thought process of going back to school and paying for it on top of it?
Yeah, I don't know. That's a good question. To me, that's why I went to dental school initially. I liked the idea of perio. For whatever reason, it was just kind of intuitive in terms of watching them do various surgeries. So I said, this is what I need to do. And it's kind of, I had to scratch that itch. And don't believe me, every time you go through perio, you're like, well, I'm a dentist. Like, I could just leave and just do my own thing. Like, why am I doing this? But I'm very happy that I did it. I would do it again. And it was probably the most fun time in terms of clinic and co-residence I've ever had in my educational process. But for me, it's something I wanted to do. And, and so I did it and I muscled through it.
Gotcha. So as you said a little bit earlier, I think it might have been before we even started recording, but you say you were doing a lot while you were in this residency program, you know, moonlighting and working and doing a lot of things. I guess could you just give us a little view into how you were balancing your time and just managing all those different things? Did you gradually kind of pick up more things, and then, you know, once you got comfortable in Kentucky, or did you know that was your game plan from the start, was to work and you to fly back and forth and whatnot?
Yeah, so I mean, I had a job in Kentucky, and I had kind of a one, you know, occasional job in New York, just doing like pure perio. So my GP practice was in Kentucky. So to balance it out, you know, they always said it's okay to moonlight, but we don't want to know about it, right? And so to me, it was that job. I was lucky enough that I could go in there in the evenings. So it was perio, and then it was GP at the end of the day. Sometimes it didn't bounce. Obviously, you know, in perio you have to present PowerPoints, and my PowerPoints might not have been as edited as they could have been. But it was a hustle. You know, it certainly was a hustle. But I think that's what life is. And so, you know, I didn't work weekends. Now I work weekends, but then I didn't work weekends, and it just, you find that balance, because I think if you don't love it, you don't actually enjoy what you're doing, then it's out. You can't you can't do 12 hours a day of dentistry. Like, it'll kill you. So I think you really got to enjoy it. For me, when I was working in my perio residency, I was looking at almost as a mini residency also. I take what I learned in perio, kind of apply it into prior practice with all my general dentistry I was doing, and just enjoy it, you know.
Awesome.
I think that's the key. I think that's the key.
Is it safe to assume that the same tips that you gave us with regards to applying to like a GPR, is it the same when it comes to specialties, or is there like a difference between the two that you would say?
No, I would say it's exactly the same.
Okay.
I would say you need to apply. The gentleman that actually told me to visit programs originally, my mentor is a big periodontist on the East Coast, and you know, for folks that would visit the program in perio, you know, we would if I saw him before and say, oh, we like him, we don't like him, that's it. You know, but if we like him, like, that guy's gonna get, or that gal's gonna get an interview, and they'd probably say, come on in. You know, so that one trip, it shows that you really want it.
And so, okay, and let me go a little bit deeper into this, because I know some people might have some more questions. So would you literally just hit up the program director and say, hey, doc, I would love to stop by and just check out the program? And was it that simple, and you would just show up and kind of get a tour and everything, or like?
It is that simple. I would just, what's that?
Oh, no.
You just email the director of your program that you want, right? And this does two things. Maybe you want to go there, and maybe like, wow, these guys are not for me. You know, I don't want to go to this program. Like, I thought I did, but I'm glad I'm not married to them for 3, 4, 5, 6 years, right? And yeah, you just email the program, say, hey, I would love to visit, and they say, great. And typically, you know, you'll hang around the clinic, you'll have lunch or whatever it might be, but you want to get that resident interaction. You know, you're not trying to impress anyone. You're not trying to show how much you know. You just want to be like, okay, and just take it all in. You just want to show presence more than anything else, and just be the person that you'd want to hang out with yourself.
Yeah.
All right.
That's what it is.
Okay.
Awesome. That makes sense.
And that's my opinion. For what it's worth.
So, you know, now we covered the residency route. The next step is like ownership, you know, and we're I want to pick your brain a little bit more about that. So what led you to the decision for ownership? Did you always have like an entrepreneurial spirit that you wanted to do it, or was it mentorship that kind of led you to make you feel like that was a viable option for you? Like, what kind of led you into that decision?
So I'll tell you, right. So in Boston, I don't own anything in Boston.
Okay.
And for me, I have my own LLC where I'll go to other offices and work.
Okay.
As an independent contractor. But in Boston, I don't own. A lot of my colleagues do own. A lot of my colleagues have done startups. For me, one of my good buddies, Dr. Mitch Miller, he does a lot of consulting for folks. He got a lot of guys that just kind of start their practice from scratch. 6 months, he got 100 patients a month. He actually opened a company called thedigitalfloss.com actually last week. But for me, it's ownership is something that you could look forward to. But right now, that's not where I am at.
Okay.
Yeah. And so you traveling back and forth from Massachusetts and New York, I mean, is it worth it? You know, is it one of those things that it's worth it to you, so it is worth it, or like I don't understand the allure of just going back and forth. Like, why do you decide to do that?
So for me, it's I kind of two couple birds in one stone, right? So I do very well here. I'm very fortunate and blessed to work where I am and provide a nice living. But I go to New York because one of my good buddies owns a practice in the city. Right? I get to hang out with my buddy. I get to do surgery all day. I could go to the city, see my brother, see some of my friends, and then come back.
Okay.
And so it's really I mean, do I need to do it? No. Do I like to do it? Yes. Okay. So a 2.5-hour drive from where I am down to the city, it's worth it. I mean, it's highly productive in terms of monetary reimbursement, and it's just fun. I mean, you get to do dentistry and work with your buddies. It really is a blessing. It doesn't not feel like work in the slightest.
Okay, and I wanna ask you another quick question because this kind of really just popped into my head. You being a somewhat recent grad, you know, we're stressed about these loans. You know, is there anything that you recommend to us, especially like in your position? Of course, you took on extra money, so like, what would you recommend? We hear a lot as far as, you know, pay it off quickly, but then some people say, you know, don't pay it off, don't worry about that in the beginning, it'll pay off in the future, whatever it may be. So like, what would you suggest that you've seen, you know, within your friend group as well as yourself?
So it's interesting. I know Mike Appa talked about going to a state school versus going to NYU. And he said, it doesn't matter for me. I mean, well, yeah, for you, Mike, it might not matter for you.
You're famous business, right?
But for me, which this is mine, and it could be, obviously, he's far more successful than I might ever be. Yeah, so that's why I hit it. That's why I went to state schools, right? It's Tufts versus Buffalo. It's NYU versus Kentucky. And it turns out I did more surgery in Kentucky than I ever would have done at NYU. But I tried to keep it low from the get-go. I was worried about it. A lot of my colleagues that are graduating GPRs and graduating dental schools are still worried about it. All my friends that have gone into practice, none of them are worried about it. Right? Because when you go from making a 0-figure income to a 6-figure income, that fear goes down quite a bit.
Yeah.
So for me, I kind of try to do a balance. You know, I understand the philosophy of doing over 30 years, because frankly, you'd rather have money in the bank to buy into a practice, do whatever. And so that works for someone. Other people want to live like a pauper and pay it off right away. For me, I did 15 years, refinanced it, and keep refinancing as much as I can. I use First Republic, which in Boston or New York is a good. So if anyone decides to do First Republic, plug my name to them. Give you like a referral fee. But I've done 15 years. I said, let me find a balance. Let me try to knock it down, but let me still hold on to some of my capital. So I would not lose sleep over it. I wouldn't make any decisions over your loans. I got a lot of friends that said, oh, I need to go do this right away because I got to pay off my loans. I would not even think about loans. I would do something that would make you happy, because there's no question, you go to work and you're happy, you will do more and better dentistry, and those loans will get paid off quicker. And when I have a good day, when I'm happy, the day is great. When I have a poor day, I'm not as productive. It's just as simple as that, and it's cliche, but I found it to be very true.
Okay, so we're about to start wrapping up the interview here, but you know, myself, Tyler, all of our classmates, we've been kind of worried a lot, you know, about the productivity and the experience we're going to get due to COVID. How is it impacting the practice side of this? You know, you say you work at 2 different practices, so have you seen a difference in, you know, the impact in each practice? Have you seen something across the board? Kind of how has COVID been affecting the in-office activity?
So my New York place is shut down. They decided to shut it off until the date. Worcester Periodontics, where I'm at, is kind of a large surgical facility. So we have a lot of reach into other referring doctors who, for us, they're not always equipped to see emergencies. So for us, we've N95, PPEs. I mean, there's protocols for the protocols. And so, you know, we're seeing a lot of just emergency patients. Those elective treatments, the sinus lifts, the big implant cases, those have been pushed off to after the mandate's kind of been lifted, or the recommendation's been lifted. But just in terms of now, yeah, things have gone down, but it's more emergencies. And I think things will forever be changed. And I think now is a good time where education's cheap and free. There's a lot of webinars, a lot of podcasts. So I'd say use this time to build up your skills and build up your toolbox, and go like our office. You stop by our office and watch some surgery if you want. Go to your local periodontist, your local oral surgeon, and whatever it might be, and just kind of try to keep your hands wet and your mind wet, in terms of teeth. So I mean, that to me, that's what I'd be trying to do.
And do you have any recommendations as far as like online content that we can ingest while we're going through this?
I think Spear is, I'm a Spear subscriber. I'm in the Seattle Study Club. I'm a Spear Study Club. I like Spear. I think Spear's a wonderful place to start in terms of, dentistry prepares you for tooth by tooth dentistry, right? And not to kill your patient, right? Now we got to kind of put it all together and see, all right, how can I look at, the forest and not the tree kind of thing, right? Get that 10,000 foot view. And so I think Spear would be a good way to, a very good starting point.
Amazing. Dr. Litwin, thank you so much for your time. We know you're extremely busy. You talking to us today really does mean the world to us. So we do want to say thank you so much.
Yeah, absolutely. My pleasure.
Awesome. Everybody, if you haven't already, make sure you go ahead and hit the subscribe button below. If you have any questions for Tyrell and I over at FutureDDS, you can send us a DM at _FutureDDS on Instagram. But if not, I think we're done today.
That'll be it.
All right,
see you guys next time.